Did you know that out of 4 women, 3 have actually suffered from yeast infections in their lifetime? Most of the women are sexually active, and this is attributed to high estrogen levels in the body. Most of the women ask themselves, why do I get this yeast infection, or why do I get these recurrent yeast infections? Besides me being faithful, besides me being hygienically clean, why do I keep suffering from this? Now, today we're going to be talking about these other causes of yeast infections and recurrent yeast infections. If you're new to this channel, um, remember to subscribe. I am Vera Savix. I am clinical officer who is passionate about reproductive health. I champion towards achieving at least a better number of women who are screened. In fact, all women should be screened for cervical cancer, because early detection is what will meditate treatment, and we're going to be avoiding late diagnoses and even death. Remember, cervical cancer is one of the silent killers that is affecting our today's women. So let's have this good practice of getting to know our cervical cancer status by screening. Now let's get our video today. So in our video today, we're going to be talking about yeast infection. First, what is yeast infection? This is a fungal infection that is caused by an overgrowth of yeast. We know yeast, and we know when we put yeast in a cup, we know that it will flop, it will swell. That is what happens to your vagina when there is that overgrowth. So yeast overgrowth is caused by fungus. That is the most common one, is Candida albicans. And in our vagina, when we have a normal flora, that is a normal bacteria that is called lactobacillus, and there are certain conditions that can predispose you to having yeast overgrowth. And one of the causes that a predisposing factor that we can talk about is continuous or long-term use of antibiotics. Yeah, antibiotics are very good, and they treat a lot of infections, but we should not just do it consistently, and especially over the counter. We should avoid long-term use also, because it can be bacteriostatic or bactericidal. It can prevent bacterial overgrowth, or it can kill bacteria. So once it kills bacteria, it can predispose us to yeast infections. And also, number 2, while we're using hormonal contraceptives, we should be very keen, because hormonal contraceptives can cause increase in estrogen. But I'm not telling you not to use the contraceptive. But if you are experiencing unexplained recurrent yeast infection, and you having an hormonal contraceptive, then it's good to get back to your healthcare practitioner to review you, and he or she can advise you on other methods of contraceptions. And also we should be vigilant when you're pregnant, because pregnancy is one of causes of immune suppression. When you're pregnant, your immunity is low, definitely, so it can predispose you to having recurrent, or you to having yeast infection. Well, also immunodeficiency diseases like HIV, and also when you have uncontrolled diabetes, you can also have overgrowth of yeast infection. And but in short, what you should avoid when you have this year to avoid yeast infection is having these tight pantyhose, like panty imekushika sana tightly. Yeah, you should avoid that. And also you should avoid antibiotics, as you said. You should also adopt good cleaning methods for you, good hygiene methods, like make sure you clean your panties well, and at least air your panties to make sure it's not damp. And when once you from yoga or exercise, you should not be in the damp clothes for a longer time. You should get out from there and remove those clothes. Yeah, and also we should be vigilant on when to use the contraceptives that we use. We can use non-hormonal contraceptive that is common. We have the IUD, it's very good, and it will not predispose you to this. So let's get to the signs and symptoms. So these are the symptoms to watch out if you could be thinking that you have vaginal yeast infection. Number one symptom is itchiness, like you itch a lot, and once you itch, there will be this whitish, caddy-like discharge. It's like this yogurt discharge, and it's whitish. We say it in Kiswahili, like you can ask, unaona ni kama maziwa yenye imeganda, like fermented milk. Yeah, that kind of discharge. And by the way, it's not smelly. And also, once you itch, and there can be swelling, or vulvovaginal swelling. The vulva and the areas will be swelling, and once there'll be swelling, there can be break or bruises in the walls of the vagina. So it's not one of the things that is comfortable for any woman. So getting to know like what causes it and the treatment is very important. As we said, like we should adopt good hygiene practices, and we should avoid using scented products on the vagina, and make sure that the products that we use are scent free, and we also avoid touching. Treatment, it can be treated according to severity, and we have three modalities of treatment. We have oral, we have vaginal, like pessary form, and you also have cream form. So orally, you can be given this antifungal. In Kenya, the common antifungal that we use is fluconazole, but there are other antifungals that can be in the market. And as I say, this depends on your severity. Then, secondly, you can be given drugs to insert in your vagina. We call these drugs pessaries. Pessaries are good because they're going to deal with it from inside. And I am sure after the first use, you'll feel a little bit of relief. So these pessaries, they can be in different dosages or packs. It can be for 1 night, 3 nights, or even 6 nights, depending on your severity and the strength of the pessary. And lastly, you can use a vaginal cream, and this one you can apply on the vaginal area to prevent you from itching. So, parting shots these days are good drug, and also it's a drug, and like I use it frequently. We call it day vaginal wash. It will help you to get your lactobacilli back, and it's a good product. It's a good product that I highly recommend, and it's not expensive. Um, it will help you balance back the lactobacilli, and we'll talk about the properties in our next video. Thanks for watching, and bye for now.